Yes, through the magic of TV, we are back in your living rooms. We're talking about health and the quality of your life with Limitless Therapy. And of course, the good Dr. Elliot Cleveland is with us to talk about more than just your feet, but we're talking about orthotics.
Yes.
That's a long word.
Yes.
Orthotics.
Orthotics, and it's
Feet
something that
and hips and
makes you feel better from head to toe, really.
make me feel better.
Yes.
Thank
so
you.
I hear you're interested in being a demo person for us, Jack.
I've got
Foot model.
feet and they're made for walking.
Well, let's get them walking.
Okay.
I'm going to have you go ahead and kick your shoes off. This is something we do. Can you kick it
Wait,
farther
wait,
than
wait.
you did
Oh,
that
he's
one?
got to hold on to
Let's
us
see.
to get
Cheer
the
him
next
on
row.
TV.
2 points.
That
points
is the
right
score
there.
right there. We want to help
1 point.
Jack's
What did I say,
feet
2
feel
points?
better, his lower leg to feel better, and relieve some of the knee and hip and back pain that often people have, whether that is an everyday individual or an athlete. So
both.
Jack, stand on that force plate for me, just facing the camera.
Okay.
And you guys can see this is highlighting right here the pressures that his feet are putting through this.
Over on yeah, oh yeah.
Look at those white legs, boy.
Yeah, perfect, Jack.
Those are
All
the
right.
whitest white legs you've ever seen.
Jack, I've taken a snapshot of that. Now we're going to have you step off to your left.
To my left.
Yes.
You're going to
towards
stand
me.
on it that way, and you're going to walk across it.
Oh, I am?
You are.
Now, Doc, I'm going to tell you this. One leg is a ½ an inch longer than the other.
Just walk, it's
Oh.
fine.
And when I walk a mile, I make U-turns.
Well, that's actually perfect for me to know. Just hit 1 foot on it at a time, and it's going to give us the exact
What do you want me to do
forces.
now?
You just step on it with 1 foot and then step over.
Okay, I'm sorry.
That's perfect.
You
Keep
do
doing that
walk
for us.
like
now,
with your
I have
foot
I have
funky.
a neuropathy, so I might wobble a little bit. You don't
No,
mind
but your
do you?
foot walk goes that
Do
way
you
when
want
you
me?
walk.
Do you want me to change feet now?
Keep doing exactly what you're doing.
Okay, do the same
Mm-hmm.
foot.
Yep. One more with the right, and then we're going to try the left. I want a large amount of feet striking.
Luckily, I have
so that
both.
we can
You ready,
check
sir?
them both down.
All right, here we
yes, left foot. All right, perfect. Try one more on the left.
Okay, I'm just.
Are you getting dizzy, Jack?
Now we're going to look at,
Well,
he's doing great.
neuropathy is a whole new thing.
Check this out, Jack. We're going to turn this around, and we're going to look at the pressures of every bone in your feet as you walk. Now, you see, you were
Little
noticing
slew-footed.
the angles that his feet are at.
Yes,
This
right?
pink line is checking out his center of mass and how his foot strikes the ground.
So does that
Yeah.
mean I'm slew-footed on my right foot?
You just walk
that
at
It
an
doesn't mean
angle
slew-footed,
more.
but this actually corresponds to the forces of every
that
single bone in your foot. And then what we can do with this is create support from the ground up and show you how we can fill in and basically from the ground up give you more support in the arch of your foot and anywhere where you don't necessarily strike ideally to
And
take
I knew I had a high
pressure off.
arch, and that reveals that, doesn't it?
Yes, you actually do have a pretty high arch, so
Yeah.
you probably need a little bit of lift in there.
Is that
to
a sign of
support your foot with the
intelligence?
ground. It is a
sure.
sign. Yeah, we should all test our feet out and then have scores and ratings
Yes,
on TV today.
Well, get
and see
Flatfoot
how that
Fuji
goes.
over here on her feet.
And then,
We'll
yeah,
check
yeah.
that out.
So, unfortunately, we don't have enough time
Flat-
to
Yeah,
do
yeah.
another one.
Fuji.
But what would you do for, like someone like Jack? Because there's so many things you can just go in and buy like a generic little
Right.
insert or something, but that's not maybe the best thing?
Right. Rule number one is don't fix what's not broken. What
Okay.
isn't broken. So if you're not having any pain or any problems, we're not going to try to put you in orthotic because that would change your gait and movement. But if you are having pain typically from the back down, and we think that's related to how you're moving, how you're walking, we would want to look at it, analyze it on here, use our own eyes and give our best professional judgment and say, is that something that bothers you with running, with walking, with being on the golf course?
How about
Yeah.
balance?
Balance is key too because
that's a
you've got a high arch, so making
Yeah.
sure that you feel supported and have that tactile sensation from the ground up is going to give you a little bit
You're
more
talking my
cue.
language here.
Right, as well as probably some balance therapy and some exercises to improve that along the way.
Because don't you see, like, a lot of people will complain, like, gosh, right here hurts so bad. It has nothing to do with your knee
Right.
necessarily. Like,
Yeah, the knee is often the innocent middleman,
Yeah.
and that's an area that I love to treat, but it's usually a problem from hip weakness or a lack of foot support and shoe support, and the knee is the joint in the middle that takes a lot of the torque and a lot of the forces from that.
Where do we find you?
You can reach out to us using our phone number, website, or our clinics are on Toy Street, so just a couple blocks over. That's where we have more of our women's health clinic, and then we have more of the sports medicine and orthopedics clinic on Woodruff Road.
That is so cool,
Okay,
because if
in
someone's
Greenville.
watching and they're like, gosh, I kind of want to do that foot thing that Jack had done on TV,
that-
is this something that you do when patients come in? This
Yeah,
is-
and we have a screening phone call to make sure
Yeah.
that it's the right fit for you first.
Right.
Some people just need orthotics,
Right.
where it's a simple change in their shoe to
Yeah.
make their pain go away. Other people need orthotics and they need physical therapy treatment. So we want to make sure that we're doing the right thing and giving you a really holistic approach to improving your health.
I love it. Yeah, Roby,
I've
you
never
would need
seen
the
anything
full.
like
You would
this.
need the
That's
full
fascinating.
thing.
Yeah, and so can we have an initial consult with you?
Yes, so typically the first part is a pretty long phone call to make sure that we're looking at the right areas to improve. And then if you're the right fit for it, then we want to set up our initial evaluation.
Well, that concerns me, this picture.
Well,
Actually, you're doing pretty well. It's more of where are the forces here. You're not having any pain, are you?
No.
It's more of just the neuropathy and the lack of feeling there.
Yeah.
That's a different situation, and making sure that you feel confident on your feet probably is going to incorporate some balance therapy in the process.
see, Jack, look, this segment was made just for you. This was good. Thanks, Doc.
This
This
is
was
fascinating,
very
Doc.
cool.
Yeah.
Limitless therapy and wellness. Get all the information there.